I'm Katrina. I'm a registered nurse at the Cameron Wellness Center. A lot of patients tell me the story that they have had gastrointestinal issues for a long time. Sometimes it can be for years and years. They've seen 5 different doctors, or maybe it just started last year and they have gone through all the testing, colonoscopies, imaging studies, all of these different things, and spent a ton of money only to be told that they have IBS. They're placed on some medications that don't actually treat the root cause of their illness, but just kind of cover up their symptoms. Or they're placed on a diet that they're told to stay on long term that isn't generally healthy to stay on long term. So what we do is we actually talk about what contributed to the start of this. It can even start from, as a child, were you born via C-section? Did you get all of the good microbes that should be in your gastrointestinal tract? Were you breastfed? Were you formula fed? Did you take antibiotics a ton as a kid? Because all of these things can actually contribute to your health today. We use advanced testing to try to figure out the root cause of what's actually going on so we can fix it rather than just put a bandage on it. Some studies have shown that the cause of IBS in anywhere from 50 to 70% of people is actually SIBO. So we can actually test for that in our office. Other places can have a 3 to 6 month waiting list just to get tested, and then they may not necessarily use the most advanced test version, or they might not actually read the report correctly for you, because there's a lot of nuances in this type of testing that we actually take into account instead of just having somebody say positive or negative and moving on from there. We actually use Multiphase Approach to help you get rid of SIBO and other gastrointestinal issues for good. That includes diet, lifestyle modification, medications if needed, herbs if we need to, and we really work with each patient on their individual preferences. So we actually work with you to figure that out and go through your whole health history and get to that point where we know this is the cause. To anyone out there that's suffering from gastrointestinal issues, come talk to us, tell us your history, don't be embarrassed about it. This is what we talk about all day, every day. We have no qualms about asking you about your bowel movements and what it looks like, and we really just are able to provide a safe environment for you to really come to us with these issues, and we can direct you towards the testing that you need or the treatments that we can just start with right away based on your symptoms.